Hi everyone, good evening. My name is Emmanuel. I find it very imperative to discuss with us this evening the topic Rabid, its cause, and of course its management. About 3 days ago, I was going out of my residence to visit somebody, and of course, on my way, I saw a dog rushing at a young man, and of course, bit him. And it seems nothing has happened to this young man. And off he left. Then I was coming behind, I called. I asked a question. What will you do now that the dog has bitten you? He said, well, nothing is going to, he will just go and use some um, rub and all the rest. And then I had to call him back. I said, no, this is what we have to do as first aid first. Then you go to nearby medical center where you are going to be treated. For this reason, I have to do some enlightenment and how to the dangers of a rabid dog, dog that rabies carrying animal, one of the rabies carrying animal. The danger behind it if not treated promptly. Therefore, I want to discuss with us rabid, its cause, and its management. The spread of rabies, which is one of the virus that we have, could not have gotten to man if a dog is being treated. And of course, animals are vector to this virus. Hence, a rabies uh, carrying animal can only introduce this virus to man if only it bites an individual when there is an opening wound, or when there is outburst of saliva that gets in touch into the wound. That is when the virus can spread into, by extension, to man. Of course, when it spreads and this happens, there will be a contamination and cause injury to the skin. And so, when it gets to the skin, it will go through the bloodstream, pass through the blood vessels, and it will spread to the body. As it spreads to the body, slowly the attack will reach the brain, and the virus will begin to multiply in an exponential way, quickly. Then it becomes the cause of severe inflammation to where? To the spinal cord and, of course, the brain. And the virus will begin to multiply quickly, and inflammation to the brain and the spinal cord, as I have said. This inflammation can cause what? Risky, and can be potentially cause of death to an infected person. Now, how does this happen? When there is a bite or there is a scratch of a rabid infected animal on a man, the dog, such an animal, example of which is dog, monkey, rabbit, and some carnivorous animals, raccoons, skunk, even rats. So there will be transmission. This also occur when the infectious material, usually saliva, comes in direct contact with the human wound, and the wound that is very fresh on the skin. Now, woman to woman transmission, mm, it is not, it is not, it has not been discovered yet. Uh, so I cannot really say much on does woman to woman, is there anything like woman to woman infection? No, I don't think so. Uh, what is the incubation period? The incubation period for this virus usually occur between 2 to 12 weeks. Although it can also occur for 4 days, depending on the proximity, the nearness of the area of infection. The shorter the incubation period, the length of the incubation period is important because it is the only acceptable period agreed. When this occur, there are some initial symptoms which seems not to be serious, not to be taken as if it is a rabid infection. It occurs in a normal sickness. And these initial symptoms are fever, headache, feeling unwell, feeling scared or anxious. And in addition, there will be pain. The patient, the victim will experience pain. And of course, there will be tingling sensation at the infected site. Now, the symptom will continue and it will last 2 to 10 days before more severe symptoms emerge or begin to develop. This usually include aggressive behavior, hallucination. You see, you start seeing what you are not supposed to see, agitation, and of course, production of lots of saliva. Eh. So it continues, and generally the incubation periods of the rabies virus is around 4 to 12 weeks after the bite of an infected animal. There are several factors that cause the times of the onset of symptoms to take place faster or slower. So there are some common symptoms that often appear early in the rabid virus attack, such as rheumatic-like tingling. After being bitten, the animal carrying rabies, usually a person will not immediately feel obviously or may not even feel the symptom. Only after a few days, some symptoms begins to appear and begin with rheumatic pain or pains, needle-like feelings at the infected site. So people who are infected with the rabies virus will also feel itchy at that site, even sore in the parts of that attack by animal carrying the virus. The second symptom is it resembling a flu-like symptom. Initial symptoms of rabies are often mistaken for flu symptom because they have similar characteristics. In the early day, rabies infection to human will cause symptoms such as high fever, chill, fatigue, muscle ache, difficulty in swallowing, difficult to sleep at night. And so if not properly treated immediately, this mild symptom could turn over worse and cause condition to get worse. The other symptom is feeling anxious and confused, like hallucination and certain anxiety disorder. Humans who have been affected or infected will suffer anxiety and easy to feel confused. It will be totally confused. Therefore, with all this, with all this, uh, uh, the government has eradicated trade in barley, for example, because of the danger of rabies. As many as 98% of human rabies causes are transmitted by dogs. So dog is mostly a vector that is found in our surrounding, where cat is not too, cat and monkey, they are not too rampant, but dog is one of uh, the well-known vector that carries this rabies. So the rest caused by cat, monkey, if not treated immediately, this will certainly lead to death. Okay, that is because of the tendency to ignore the condition of the body after being bitten or scratched by the rabies. So that is why I have come out. We need to start taking cognizance or be aware of our environment and the next action to take. We should not take for granted bite of a dog. We should find out if the dog is being treated. If not, we have to go hurriedly to the hospital. Um, According to Control of Animal Source Disease Department from the Ministry of Health in Indonesia, he has categorized or divided this symptom into 4 stages, which is prodromal stage, sensory stage, excitation, and paralysis. So in prodromal stage now, many consider it as an ordinary virus. The virus is being considered as ordinary or viral infection because the signs of symptom when it shows weakness and lethargy, decreased appetite. You think you are having malaria, fever, insomnia, nausea and vomiting, severe headache and sore throat. Of course, this will if not properly, accessed, you will not be, you will not be able to understand that this is as a result of a rabid carrying animal that bites an individual. The second one is sensory stadium, which is stimulation stage. So in stimulation stage, attack or overreacted to what? Sensory stimuli. Symptoms include pain, burning sensation, and tingling in the bite of the wound or scratches, as well as increased feeling of anxiety. Sensory, all your nerves and all the rest is beginning to enter your nerves, and you're beginning to have anxiety, pains, burning sensation, and all the rest. So symptoms of physical change begin to appear. Physical change symptoms begin to appear. Someone who have been infected with rabies at this stage starts screaming, funny behavior, running and jumping around. Sometimes you even grab your hair. You'll be afraid of water, light, and of sand whenever you see or hear, all those on site. Excessive drooling and bodily fluids such as tear will start coming out of your body. So in paralysis stage, which is the last stage, the, it is being characterized by mouth gapping. Mouth gapping, you may not be able to, the nerves that help in closing your mouth, you may not be able to close it very well. Paralyzed from the feet to the respiratory muscle, making breathing difficult. You see? So within the 4 to 6 days, within the 4 to 6 days after the first symptoms appear, a sufferer can actually die. So how do we treat? The treatment, the first treatment is first aid treatment. When you see such a victim, what to do to the person and take the person to a clean tap water. You open the tap and allow it to rush on the site of bite for good 15 minutes. After that, you get your mild detergent or soap. Then you wash the site. After washing the site, then you antiseptic lotion, and of course you clean the site. If no blood, you don't wrap. But if there is bleeding, then you might do a mild wrapping and immediately take such victim to nearby medical center. And when you get the patient there, the patient will be given anti-rabies serum, which is a periodic vaccination. Now, if this patient has initially been vaccinated against rabies, the only uh, the only dose such a patient the only dose such a victim will take, it is uh, a rabies vaccine dose that uh, the 7 day and of course the 28th day. Such a patient has not taken rabies vaccine before. Then this patient, after the post-exposure prophylaxis (PEP) is given to the patient, that's the rabies immunoglobulin vaccine is given to the patient, then it will be 0, 3, 7, 14, 7, 21, and of course the 28th day, which is the booster dose. By the time such a patient has taken all this, then the patient is rest assured that um, he is okay and is ill and healthy. And of course, as I've said, the best treatment here is prevention. You pet keeper that have pet in your house, I urge you to please immunize or vaccinate your pets. Treat your pet periodically so that the pet will be free of this. And of course, those that have no pet, you have to, run away from any rabies carrying animal, especially dog. Even the cat lovers, we have to be very careful about it. Playing with monkey too is very dangerous. Please, let us always prevent or protect ourselves from all this. I pray and I hope that these small tips or small tip of study will be able to go a long way to help us in our society and of course in our community. I come once again around very soon to discuss another topic with us. I remain yours, Emmanuel. Please, when you have question, you can drop it and answer will be made. Thank you very much.